The Commissioner of Health New Zealand has described a cocktail of issues at the troubled agency in his first appearance at a Parliament Select Committee. Lester Levy was appointed 2 months ago to deal with serious financial concerns at the organisation. But he showed up at the hearing without any financial documents. Here's senior political correspondent Jenna Lynch.
This is the man charged with turning around our financially crippled health system, Dr Lester Levy.
The financial position is quite precarious.
And he's charging a pretty penny for it, 320 grand a year. Not that it's his only job, he's also working 2 days a week at AUT.
The job is never put as a full-time job, but I would propose to you if you're working 10 to 12 hours a day on a particular job, that's quite a lot.
And he'll need to work round the clock to fix this.
We do have quite a cocktail of issues that we're needing to deal with.
Levy was appointed when Health Minister Dr Shane Reti discovered a looming $1.4 billion black hole in the health books.
It keeps getting cast as cost savings or cost out. All we're actually doing is actually trying to get back to budget.
That back to budget approach has led to frontline workers coming forward to say there are hiring freezes, staff aren't being replaced, the health system is struggling to keep functioning due to cuts. We've even had hospitals closed overnight due to staff shortages. But Health NZ denies a freeze, saying the number of full-time equivalents or FTEs on the front line is rising.
We have increased clinical FTEs over the last 12 months to June by over 4,100.
3 News asked for a breakdown of these figures. They show most of the extra staff are nurses, a gain of 2,586. There were 514 more allied and scientific workers. That's jobs like pharmacists, radiographers and occupational therapists. 528 more care and support jobs were added, 114 more midwives, 205 more senior medical officers and 157 resident medical officers.
Distribution of those FTEs may not be in the areas where we do have vacancies and shortages. So, ED departments, mental health, critical care are areas where it does take us a lot longer because of the highly specialised skill sets that we need.
Today was the Commissioner's first appearance before the Health Select Committee, the first opportunity MPs have had to grill him. But he showed up without the detailed financial reports they had requested.
We were not given the information to be able to hold Health New Zealand to account.
But Levy says the financials are not his main focus.
A lot of attention has been focused on the financial issues. That is not the main show in town as far as we're concerned. The main show in town is actually getting these waiting times down.
The government has set a target for elective treatment that 95% of people should wait less than 4 months. When the government announced the target, 62% were getting treatment within 4 months, but it's gone backwards, only hitting 56.4% in the latest data.
That is the actual real mission here, to get waiting times down to levels that are acceptable, because currently they're not acceptable.
Clearing the wait lists is an expensive exercise.
That's the one where additional funding is always useful.
Oh, look, we have a range of discussions around planned care, and at this point we're actually talking more about how this can be done inside a baseline, actually.
So have you asked for more money for planned care?
No.
And when it comes to government money, don't ask, don't get.